May is Stroke Awareness Month. Strokes are the 5th leading cause of death and the #1 cause of disability. The statistics are often overlooked until it happens to you or a member of your family.
Which is the case for WHO 13's Roger Riley. See, last summer, his brother suffered a stroke, and tonight Roger reports on the medical team that helped save his life.
This is my brother, Warren Riley. He's a pastor at St. Paul Lutheran Church in Tama.
If it had not been the Lord who was on our side.
Last August, something strange happened.
I was practicing my message for Sunday, and it was just a normal Saturday practice. The second time through, I started having unexplained problems. I started drooling from my bottom lip. I don't know, somehow I just ended up right here on the floor. I thought there was a hymnal or something on the floor, and I was reaching to try and figure out what was behind me, and then I figured out what was behind me had fingers. It was my left hand.
He decided to get into the pickup and head a few blocks to home.
When Shelley realized that I was home, because I smashed the mirror of the pickup into the garage door.
I got into the passenger side, and something came to mind that if somebody's having a stroke, you ask them to smile. And so I asked him to smile, and he couldn't because the left side of his face was drooping.
It wasn't long. Local EMTs had Warren en route to Grinnell to the hospital, where they saw an ER doctor who gave him a drug to break up the clot.
It was really quick, and he could tell right away within minutes that Warren had had a stroke.
Then it was into the helicopter for a quick trip to the University of Iowa hospitals and clinics.
I remember the procedure, and I wasn't on a table. I was sitting up because they needed my head straight, I think, so they could somehow see where they were going in my brain, and it was excruciatingly painful.
After it was over, Warren had some slurred speech.
We got introduced to the pilot and the nurse on flight, and I don't remember his name.
But after a couple of nights in the hospital, Warren was bouncing back. It wasn't long before he was celebrating his daughter's graduation. As amazing as my brother's recovery was, the team that worked on him at the University of Iowa hospitals and clinics say that that kind of outcome is becoming really more common. Last year, the University of Iowa hospitals and clinics treated 172 patients like my brother with something called mechanical thrombectomy.
When there's a blood clot in one of the main vessels in the brain, this is a procedure where we can go through the vessels in the body, usually from the groin area, and we feed some catheters all the way up through the vessels in the neck, all the way up to the vessels in the brain. And we can use either a little stent device that kind of grabs this clot, or we can use a suction device that we can put up there as well, and we can pull this clot out.
And getting Warren treated and onto the chopper in Grinnell was Dr. Clayton Francis.
The EMS notifies us typically that we have a potential case, and if we hear that, we announce a stroke alert, we call it, and that mobilizes the whole team.
Say thank you on behalf of our family for your work. We really appreciate what you did.
Just want to make sure you thank the team, because it's really a team effort. Without the team, I'm nothing.
I think initially, and especially having family members and everyone kind of realize what could be a stroke, and in his case and in a lot of people's case, recognizing some weakness on either the face, one side of the face looks like it's drooping a little bit, or having some trouble using an arm or a leg. That's a really common sign of stroke. Another one is inability to talk. And so sometimes people can't form words.
Well, that's what one of our friends said. Oh boy, God was really looking out for you in the way that this stroke happened, and yet you have like no side effects because everything happened just right to get you at the right place at the right time.
From Tama, Roger Riley, WHO 13 News.
Quickly identifying those symptoms. That's the fastest way to get a patient treatment. And FAST happens to be the acronym we all need to remember. So F stands for face drooping. Does one side of a person's face droop? Do they have numbness? The best thing to do is exactly what Shelley did. Ask the person to smile. The A stands for arm weakness. Ask the person to raise both arms. Check and see if one starts to drift down. The S stands for speech difficulty. Can the person speak? Are they hard to understand? Ask them to repeat a simple sentence like, "The sky is blue." The final letter stands for time. If a person shows any of those symptoms, It's time to call 911 and get him to the hospital, and we're so grateful that this worked out the way it did for Warren.
And you know, so many of our lives have been touched by this. Jody Long's brother had a stroke at a very young age. Our friend Michael Mackey had a stroke at a very young age. So, you know, oftentimes we think, oh, it's just old people that this happens to. No,
not the
it
case.
isn't. It can happen to anybody.
It is amazing. And a miracle that he was able to drive all the way home in his truck, hit the side of the garage. I mean, that is
Thank goodness.
miraculous kind of stuff.
I
going
know.
on.
Thank you.
Yeah, no doubt.
Amen.